Welcome to episode 397, where I'm speaking with Dr. Sujatha about cancer and particularly understanding the root cause of breast cancer from a dosha, dhatu, emotional, and ama or toxin perspective. Dr. Sujatha details the Ayurvedic approach to healing and recovery, along with preventative measures you can implement today. So please stay tuned to learn more. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. Hello and welcome back to the Elements of Ayurveda podcast. I'm very happy to welcome back our regular guest, Dr. Sujatha Kekada, who is the head physician and co-founder of AmrtaSiddhi Ayurvedic Clinic in Ubud, Bali. Dr. Sujatha is a certified doctor with a degree from Rajiv Gandhi University in India, and she has a profound understanding of Ayurvedic medicine, and her deep love for plants is the basis for her exceptional ability to diagnose the root causes of diseases and to find effective remedies. Combining intuition and compassion with bright intelligence and rock-solid pragmatism, she is able to effectively guide people truly individually, just as the spirit of Ayurveda demands. Dr. Sujatha, welcome back to the podcast. Always great to have you here.
Thank you, Colette. Thanks for having me back again.
I'm really looking forward to this conversation today. It's a much requested topic on breast cancer, and let's dive right into it. How does Ayurveda understand the root causes of cancer in general from a doshic and dhatu perspective?
According to Ayurveda, the cause of manifestation of cancer is primarily begins with vata and with the involvement of kapha. These are the two main things. Vata causes the proliferation, aberration of the normal process of multiplication of cells. There is an interruption in the normalcy and abnormalcy start to happen, and there is a direct involvement of vata. Anything to multiply, anything action to take place, vata is involved. And Ayurveda calls cancer is the two main terms used to define cancer in Ayurveda. It's called arbuda and granthi. Arbuda is something which grows into bigger mass, like whereas a mamsa dhatu, there's a growth involved in it. And granthi is something which is nodular. With this classification, arbuda is defined as something which grows fast and something which is going to kill. This is the root definition of means in Sanskrit. And granthi is a nodule which is more related to benign cancer. So there is involvement of vata, which creates the abnormal multiplication of cells along the accumulation of kapha that creating into a mass. So directly, the cancer formation, direct involvement of vata and kapha dosha is seen.
Okay, great. Thanks for breaking that down. And so then you mentioned mamsa dhatu in the case of arbuda, because mamsa dhatu being muscle tissue. So that's, of course,
something close for us to understand because there is a mass and mamsa dhatu is there. Along with that, rakta and meda and mamsa. 3, there is a adipose tissue involved. Of course, we know any cancer, there is a massive blood circulation is needed. There's a whole network of blood that's supplying this abnormal vicious growth. So there is a rakta, mamsa, and meda dhatu, and it is a mass. The direct word, which looks like mamsa dhatu involvement, is direct, which is visible.
Okay, and just to explain to people, meda being the fat tissue, and rakta, as you just said, is the blood giving these cells the blood supply from which they're growing and multiplying. Okay, and so what role do ama and rasa dhatu, rasa being the first tissue or plasma tissue, play in the development of cancer, in particular breast cancer?
Okay. Before we jump into the topic of ama, there is 3 ways cancer get manifested. One because according to Ayurveda, cancer doesn't happen just like this. The predisposition for cancer has started quite a long time ago. And by the time it's detected by the modern world, modern medical system, cancer, it's too late, right? But even in the Western medical system, there is an understanding that cancer manifests before it could be manifested from a chronic inflammation. Western medical system also greatly agrees that inflammation is a predisposing cause for manifestation of cancer. And also, there is an understanding that a chronic diseases like ulcers, ulcerative colitis, which can lead into cancer. And which is something Ayurveda talks about, Shofa, Visarpa. Visarpa is a skin condition. Like we talk about melanoma, irritation in the skin long time, it can lead into skin lesions. Abscess in intestines can lead into cancer. Ulceration can lead into cancer, like in a colitis or ulcerative colitis condition. And we already talked about this growth, abnormal growth happening, multiplication of the cells abnormally, involvement of the blood vessels, fatty tissue, and then the muscle tissue. And another classification in Ayurveda we call cancer, which is related to blood, like, blood cancer, lymphoma or leukemia, all these things, which we call under a category of a disease called Pandu, which is directly affecting the blood tissue. So there is a three main category how cancer can manifest according to Ayurveda. And here, for finally, what Western medical system calls as cancer, that's the final stage where it is detectable. So many underlying changes has happened where we fail to protect ourselves and cancer is manifested. It has reached a stage, it becomes detrimental to our health. Casualty is much more higher here. So there is a direct involvement of ama. Ama is we call Lina Avastha. That means ama has accumulated and settled inside the cells, and then it disturbs the intelligence of the cells, and the cells are not able to multiply in a healthy way and reestablish themselves in a healthy way. Because inside our body, constant destruction is happening and constant creation is happening. And there is a interruption, aberration happens in the presence of Lina Ama inside the cells, disturbing the intelligence of the cells into forming healthy tissue. So that's how, when Ama gets formed in the digestive system, it is carried by Rasa Dhatu, the first formed Dhatu, or the first formed tissue that nurtures the other tissue. So that travels and go into Lina Avastha inside the cells, and cells in Ayurveda group of cells we call Dhatu. And when it goes inside the cells and disturbs the normal cell function, and then the cancer manifestation takes place.
And obviously where it manifests can vary. The ama is carried by the rasa, the plasma, which brings nutrition to all the other tissues. And then where those cancer cells take hold can vary, right? Whether it's a genetic weakness or other weaknesses in the body. Can you speak
Absolutely.
a little bit?
A genetic weakness, emotional weakness, a infection, predisposed infection in a certain part of the body, inflammation in a certain part of the body. And then this ama, I want to bring in another understanding here to understand ama. I think in general, we call ama as toxins. But my teacher always says there's a difference between ama and toxin. Toxin in Ayurveda, there's a branch called Agada Tantra. So there, it's a poison that could be removed. There is an antidote for the poison. But for ama, there is no antidote as such. It need to be digested by the body and need to be pachana, we call it, need to be digested and eliminated by the body. So there is no antidote. So ama is it's from the food itself. When the food gets failed to transform itself into the rasa dhatu or fail to transform that into what needed by the cells to recreate themselves. And it's an identity crisis.
Mm-hmm.
Ama is an identity crisis. Ama has no recognition. That's neither a waste nor a nutrition. It's in a limbo state. And when that accumulates in the cells, it creates the same limbo state to the cellular intelligence. Cellular intelligence doesn't know what need to be done. And as every cells are accumulated with this ama, it completely loses the intelligence, which is supposed to form a healthy cells. It's going to start forming abnormal cells. And there is a vriddhi of vata and then abnormal kapha. So, and a healthy kapha does the nourishment of the body, but a dosha kapha or abnormal kapha makes this tissue accumulation in a foulful way. Abnormal way. Instead of nurturing the different tissue, abnormally it get accumulated in creating the growth. So that's how cancer manifestation happens. A lot of the quality, it's not able to nurture the tissue, but kapha is doing its function as something stagnant, accumulated, not moving. A foul manifestation in the body. So that's how you see the combination of vata, unhealthy multiplication, and then stagnation, which reflects the quality of ama. And then in here, we are talking mainly about breast cancer. And if a person, we know one of the cause of breast cancer is estrogen sensitivity, right? So that means the abnormal accumulation of estrogen, and that along with ama, instead of, estrogen is known to enlarge the breast tissue when it is really needed, puberty time, or the lactation or pregnancy, all those things. So there is a limit how much it can and how it should be. But when there is ama, cellular intelligence is lost and estrogen is there, and then it uses the estrogen in a wrong way. So there is no threshold for the breast cell to say, okay, now you need to stop. It doesn't have that intelligence. It's not the intelligence. There is chaos from vata. So it keeps multiplying. But there is an estrogen sensitivity because estrogen makes the breast tissue grow and increase the bulk naturally. So that's why in one of the cause of breast cancer is estrogen, high level of estrogen in estrogen sensitivity. It's not that estrogen is bad, but along with the ama and certain factors makes breast as a target organ emotionally too. I always talk about diseases and relationship of the emotions. For any cancer, one of the biggest emotional cause is fear and insecurity. And fear and insecurity is also one of the cause for vata aggravation. If we could work towards keeping our vata healthy, no matter what's your constitution, but if you are a vata constitution, you're more prone for fear and anxiety and insecurity feeling. And particularly women with the breast cancer, here the insecurity about being a woman, being good enough, or if she has a role of a mother or a wife, is she being good enough, and can she provide? And breast is an organ that provides. As a mother, breasted organ which provide. And if she starts feeling insecure about our ability as a woman, ability to care, ability to be in a man's life, to nurture, and if she's not feeling appreciated, and she feels not valued, and she starts to doubt, and when she becomes a mother, if she feels like she hasn't done a good job as a mother, or she blames herself for anything goes unpleasant in her children's life, and if she has a fear of that, insecurity of that, it's more likely that women, if she has an ama, if she has aggravated vata and any chronic disease, likely to affect her breast.
Very interesting. Yeah. And I really appreciate that way you always bring in the emotional concept here, that fear and insecurity can aggravate vata, and then that can cause further aggravation. And also with the breast, does the accumulation of estrogen sensitivity increase the density and the fibrous quality of the breast tissue as well? And then you have the lymph nodes right there. Can you speak a bit on that? And I know if a woman has very dense breast tissue, that it can be very hard in a mammogram to detect even abnormal cell growth.
Yes. That's true. And it boils down to these, one of the women personal care is like taking care of your breast tissue, like a regular massages, and also taking care of yourself, during your menstrual cycle time and menopause time. And we get a lot of different chances where we can, take care of ourselves and pay more attention. Menstrual cycle is a time, definitely a time where we all need to slow down, take care of ourselves. It's the time Amapachana takes place. Body eliminates body. It's a Shodhana time, natural Shodhana. So one of the mentioned way to prevent cancer is regular Shodhana, regular purification, regular giving time for Amapachana. So for
Cleansing the
us,
body.
men,
Yeah.
yeah. And we have more of these cycles that nature has created to pay attention. So during the cycle, to avoid certain kind of food, certain activities, take good rest, and nurture oneself, eat simple light food, improve your Agni, all those concepts what we have during the menstrual cycle time to take care. And also, even before that, when you have menarche, welcoming into that feminine path with nurturing food and love and affection, and different kinds of preparations are done. I think in one of our podcasts we have covered all those things. So these all things, taking a break and paying attention, this is what you teach a young woman. Okay, there's something new happening, there's something changes happening in your body, which gives you a great power to create life, but you need to pay attention. Right. So, this awareness teaches how we can take care of our body, prevent vata aggravation, and prevent ama formation. So we don't need to end up having a cancer of breast or any other part of the body later stage in our life. So this is a way to see. And with a dense breast tissue, part of the care is also self-massaging. So you can feel your breast tissue, and you can notice if there is an abnormal change. So you can catch it at early time. So it could be cured.
Yeah, that's true. And yeah, it's knowing your own breasts and knowing what's normal and what's abnormal. And I think just adding that into your Abhyanga oil massage routine, where you do a breast massage and, possibly go up towards the armpit as well, so you're getting into the lymph nodes there and helping the breast and cleansing the breast. And can be a small detox practice in itself, right?
Yeah. And yes, a big bunch of lymph glands are around our breast tissue. And lymph glands helps to remove what is stagnant.
Yeah.
Like when there is a stagnation, that's also what we call in Ayurveda shofa, which is inflammation in a simpler translation is. So keeping your lymphatic system working well is another way to prevent cancer formation too. So that means regularly exercising, lymphatic drainage massages, swimming, or simply jumping on a trampoline, keeping your muscle active.
Yeah.
This is the way you can move your lymphatic system good. And lymphatic system is connected to kapha. And we talked about kapha being another supportive causative factor for manifestation of cancer. So, kapha is a stagnant energy, but you don't want that to get too stagnant. So you want to keep your channels clean. That means your lymphatic drainage system working well. So regular massaging, dry brushing, all those things can help your kapha or your lymphatic system without getting stagnant and having a good flow. Anything is stagnant becomes stale, as we see in nature too.
Yeah, exactly. You talked earlier about, foods failing to transform, and that's ama, having an identity crisis. And you talked about the two forms of ama. And I just want to review for people who are new. Of course, ama is when food isn't broken down completely, and so the body doesn't recognize it, and it cannot be absorbed and assimilated. And we've covered this various times, but just to review quickly, that could come from a diet of highly ultra processed foods, or a diet that's not in sync with your unique constitution. And like you said, maybe a stagnant lifestyle and emotions that are not processed or digested as well. Is there anything else that you wanted to add to that?
Um, and also eating food, one of the direct cause one can see is you're eating food when you're not hungry, when your agni is not good, ability to digest is not good. You could choose organic food, superfood, food that's suitable for your constitution, but if you don't have the right agni, that ability, like related to your digestive enzymes, hydrochloric acid, everything that produced by pancreas and gastric juices, all these things that's you need to digest the food. If that's not good enough, that's not potent enough, even though you may be giving organic superfood, food for your constitution, you may not be able to digest. So it all falls down to Agni, and before that falls down to your dosha being healthy, because if your dosha is unhealthy, it's indirectly going to affect the Agni. So it's like you have a burning flame, and if you have a strong wind, it can also, destroy the fire. If you have a strong kapha, it can make the Agni go very dull. And here we need to introduce now our pitta dosha also. We talked about, vata and kapha being the causative factor main, but pitta get involved at some stage, and that's when the cancer becomes very aggressive. So that means while treating cancer, you want to make sure that your pitta is really, kept under control. Aggression, anger, spicy food, alcohol, fatty food, too much indulgence in heating activities like it's sauna, steam, or exercising, sunbathing, all those things. You have to be careful. That would increase your pitta. So the pitta can be involved in a later stage where the cancer becomes very aggressive.
And you mentioned, and I'm going back to the lymphatic system, because that essentially is our immune system, and it can become quite stagnant, as you suggested. And that you mentioned exercise is important for that. Another way we stimulate it is through Abhyanga. Can you talk a little bit more about the lymphatic system? And, it doesn't have a pump on its own. So we really need to help pump this lymph around the body, right?
Exactly. Yeah. So lymphatic system is called drainage cleaner of our system. It's a garbage collector, basically. So as we know, heart pumps the blood, and your arteries and capillaries brings the blood into your cells. And as it supplies this, there's some leakage happens. It's like a water supply system. It leaks as it carries. And as the blood is collected also from the cells back into the heart again for oxygenation, some leakage happens in both the ways. And what that leakage is our lymphatic fluid. And that lymphatic fluid, like a lymphatic system, with the lymph nodes, it collects all the fluid by the help of contraction of your muscles, because there is no other pump like heart, and goes into the lymph nodes. It gets filtered, removes any kind of bacteria or anything, because it's out of the system. We want to take it back to the system. So there is a clearance takes place in the lymph gland. And through the thoracic duct, it gets poured back into your right side of your heart. And then it continues the circulatory system again and getting reused. So when this circulation of lymphatic system fails, that means it just stays there accumulating. And when anything accumulates, it also blocks the channels. And blocking the channels, we call in Ayurveda shrotas, different channels, carrying blood, carrying energy, carrying prana, all those things. People who are not aware of or not yet able to understand this, visualize this, you can think of, when you studied biology, we talks about osmosis. Fluid and material solvents moving from inside and outside the cell. So imagine that around the cells, there is an accumulation of this fluid blocking. So and capillaries are very micro, that means if there is so much of blockages, it puts pressure on your capillaries and the nutrition cannot go in. So that means your cells can be starved, but swelling is around it. And so cells don't get the right nutrition. Mitochondria doesn't operate well and doesn't produce your energy. You start feeling fatigue. And then, collectively cells don't work well, then your organ's going to not do the function. So it's not going to take the nutrition, get the waste. It's not going to. So when these things happens, when the organs are not working well, then only you can see that in your blood work. But by then, so many changes has happened in your system, and you're not able to fix it unless you have an Ayurvedic understanding. When you see these minor changes of, we clearly describe ama lakshana. One of those things is shota, like a feeling swollen inside the body, or you're feeling constantly bloated, having a foggy brain, or thick coating on the tongue all the time, feeling really heavy. One of the descriptions is felt like you feel like you're walking around carrying a wet leather on the body. So it's like a damp, wet feeling that's stagnant. So these are the way how relationship to lymphatic system and lymphatic system creating the stagnation and can interrupt the cellular function, then manifested in a organ dysfunction.
So when somebody comes to you with, and I don't know if you have a particular case study you could share with us, where do you begin with somebody who's presenting with breast cancer? Maybe they've been through the Western medical system. Can you talk a little bit about that? How do we get that communication going right in the body?
I've had several different stages. Women came to me with breast cancer. So it's basically, I really need to understand. I go back, 5 years before breast cancer is manifested. What's been going on in their life? What's out of balance? What caused the dosha imbalance? So it's important to treating any diseases approach to Ayurveda, understand the causative factor, because if I just cure the symptom and you go back to your place and you have a tendency to continue or indulge in or getting affected by the causative factors, most likely to manifest again. So understanding the causative factor, I can create a map of how this disease manifested. And then I start to treat, whether it's a vata, pitta, or involvement of the blood, or involvement of the fat, involvement of the mamsa dhatu, basically keeping the body free from ama. So ama pachana is very important. We do panchakarma in that case to remove the excessive ama. So creating a healthy environment in the body so the nutrition medicine can start working, and work on the emotions. Emotional root cause, what created the cancer. That's also one of the important things we work on. And as I said, you don't want to prevent all sort of inflammation. So diet plays a very huge role in keeping the system free from inflammation. So emotional work, understanding the root cause, reducing vata and kapha, and preventing vata pitta aggravation. These are the 4 different approach we take treating a cancer or a breast cancer.
Okay. And pachana, cleansing, as you mentioned, and in your case, you'll be doing a panchakarma on site. And, many of these yogis may already be in, Western medical system, and of course, getting treatment, whether it's chemotherapy or radiation. And so what role can Ayurveda play alongside allopathic treatment?
Chemo and radiation increases pitta. So I told just before that we want to keep the pitta under control. So most of the time, people who have went chemo radiation, they are helpful therapy. They are helping. But I also see in 50% of the cases, those treatment doesn't work, chemo and radiation. But they have so many other side effects, neuropathy, hair loss, numbness, digestive discomfort, all those things, increased pitta symptoms. Everything is like burnt. There's too much of quality of Ushna and Ruksha, dryness and heat. And this body survives with the quality of, Ojas, for example, which is an opposite ama, which is Snigdha and Shita. And right,
so cooling and just to explain, translate that. So it's cooling and unctuous.
And unctuous, something moon-like energy. But in cancer, there's too much of dryness and heat. So it's like burning, right? And when you do a chemo radiation, these quality increases. And first, my first thing would be to reduce this discomfort. The first visit will be only working on reducing the side effects a patient suffers from chemo and radiation. That becomes the first step. And, all this pain, inflammation, either weight loss or neuropathy, burning sensation, people, depending on where you had the radiation, some people have had like a whole mouth, like if they had oral cancer or something, whole mouth feeling burned. They can't eat any food. or other, in several breast cancer women, they've had a lot of neuropathy, burning sensation, tingling sensation, uncomfortable feeling in the bottom of feet, like a raw feeling, skin feels raw, so, these kind of burnt sensation. So usually the first session, if people have done chemo, my work is to undo the extreme discomfort they are experiencing, the side effects.
Right. So yeah, getting the body back in balance.
Yeah.
After such intense treatments, right? Mm-hmm. And what about when there's reconstructive surgery or a mastectomy? Mm-hmm. Where can Ayurveda help in recovery and healing?
One, healing the trauma that body experience or women experience of, losing the breast tissue or a reconstruction. So women needs a lot of reassurance, care, and love, because it's one of the important part of our body is being replaced or taken away. So a lot of love, nurture, care through different treatments, so particularly treatment like Abhyanga, Pirichil, Tailadhara, all those things we do. And also we do some emotional work through theta healing, marma therapy, or emotional spiritual counseling works. And if there is a scar tissue, supporting the healing of the scar tissue, removing the scar tissue debris. These are the things we offer after the surgery to recover and gain confidence back again.
Okay, great to hear. And we talked about now some of the causes, the 3 ways cancer can manifest. We've talked about the lymph system and so on, estrogen sensitivity, and diet and lifestyle and exercise are very important, and our dinacharya. Do you want to address any particular preventative steps that people can take from an Ayurvedic perspective to maintain breast health?
Is your question for people who are already diagnosed with breast cancer or in general?
In general, because I think it is, it's a concern for all women, right? And we have our regular mammograms, but we're always concerned about it, I think.
Yeah. I think any women, if you heard about Ayurveda, explore more. And Ayurveda talks a lot about dinacharya and rutucharya. And as a part of the dinacharya, a daily maintenance of your body, mindfulness towards knowing what your body needs and providing the right thing so it can operate. And then we have Ritucharya. As a seasonal changes happens, you also need to adapt to that changes. And in the Ritucharya, they talk about regular cleansing processes. The springtime to cleanse your kapha, falls to cleanse your vata, and in the summertime, it's to cleanse your pitta. So, which is done through a very specific diet and also a simple cleansing methods that you can follow at home. I think, Colette, you offer something like this, seasonal cleanse. And these are the thing for women to follow at least once a year, because you don't need to do all the 3 doshic ones. You can lean towards what's your main dosha and you could focus on that. So these kind of cleanses, dinacharya, rutucharya, and paying attention when you have menstrual cycle. If you're going through a menopausal time, also paying attention to see how you can transit through the perimenopause into the menopause state. So nurturing yourself, working on your emotions, basically strengthening your body so that you can cope with any form of stress. Because stress will be there. Its ability that how you can cope with it, that's what tells you your vata is going to be balanced or it's going to be disturbed.
Yeah, really building up that resilience, because stress, as you said, it's going to be there. So it's how you handle it and building up that buffer. Yeah.
Exercise also helps to pattern off the ama, but the right way of exercise. Exercise in the morning, and you need to include in your exercise some degree of cardio, some stretching, and some walk. And yoga plays the best exercise because it can be cardio, it also be stretching, and it also works in your prana. Circulation of prana is important. Stagnation is when prana doesn't flow through, this vital life force. Blood carries oxygen. So, if you have swollen channels, oxygen doesn't move through. So focusing on your inhalation, exhalation, expanding your lung capacity, that's what gives you sustainable energy and ability to cope with stress. Which is contradictory in gym, when we lift weight, you just go, you just tighten everything, your breath, you hold breath.
Yes,
right?
true. Yeah.
So you don't take a deep breath when pumping or thing. So you shrink your lung capacity, you tighten the muscle. So cardio is needed, but you can enhance your cardio by breathing long deep breath and using your body weight and exercising in a way that you don't constrict your abdomen or diaphragm. There's yogic practices where you can constrict diaphragm, where you practice bandhas and stuff, but that is a meaningful way of doing it. But doing exercise with stretch, with walking, doing some pranayama is a great way to prevent ama accumulation in the body and where you support the ama pachana.
Yeah, great points there. And just to let people know, if you're new to dinacharya, ritucharya, or exercise for your doshic makeup, I do have episodes. I'll put a link to those in the show notes so you can get more information on that. And I think we need to talk about products we're using, particularly, the breast being so close to the armpit where we have lots of lymph nodes, and we need to be very conscious of the products like deodorants that we're using, right?
Yes. Skin is an organ, and anything we put on the skin get absorbed, whether it's good or bad. Yes, our skin have got a barrier. It has some intelligence, but it's not always and not 100% going to filter everything that going to put. And but if you're going to constantly doing it, it's also going to adapt to that and can absorb unwanted substances, which can become an irritant, because irritation is one of the cause also for manifestation of disease. So you don't want any of these chemicals become an irritant in your cells and creating an abnormal mutation of the cells. So try anything that you cannot orally take. You don't want to apply that over your skin. So changing into a natural deodorant and natural soap, natural form of shampoo, all those things are definitely beneficial. For body wash, Ayurveda talks about mixing together chickpea flour and mung bean flour, and putting a little bit of ginger in winter's time and putting some vetiver powder during summertime to keep it clean. And it cleans, it refreshes, it doesn't take off extra moisture from your skin, and creates a good pH that to protect any kind of bacterial or pathogens getting into your body through the skin. So you could do those kind of natural cosmetic, natural things that using things that you can eat.
Okay, now I know people are going to be wanting to know more about that recipe. So what do you mix the chickpea flour?
Yeah, you can take equal quantity, for a body cleansing. I think if you could take like a 2 tablespoon of chickpea flour, 2 tablespoon of mung bean flour, put a half a teaspoon of ginger powder and make it into a paste, and you apply like a thin paste all over the body. Just cover first, and then you can just rub it off, with damp hand. And it works like a scrub, removes your dead skin and cleans. And this is a mixture that in India, babies never get soap. The Pears and the Johnson & Johnson soap came. It started as people who could have money, they would use it. I think probably my mom bathed me in my early one or first year or the 2 years. Kids don't get soap.
Yeah.
You just get massaged with a homemade coconut oil or ghee, and then babies are showered in these kind of mixtures. So
yeah,
if you can do this, or if not, don't worry. There are so many natural soaps
sure,
that you can get.
Yeah,
right?
I think people are more interested in making their own all natural. But I think it's very important that people are aware that what you put on your skin is going to be digested. And so, as you said, Dr. Sujatha, if you can't eat it, don't put it on your skin, because it really is causing lots of endocrine disruption in the body, which in turn can lead to a lot of miscommunication in the body. So as we finish up here, Dr. Sujatha, is there anything else that you wanted to cover here? Any other, awareness or practices in regards to breast health?
I think one thing I can tell women is like when you're in your menstrual cycle, really take some time off for yourself. Don't push yourself either with too much exercise, staying up late. Sleep is really, really important. One of the way you can disturb your vata is not having good enough sleep. And here, we talk about 7 to 8 hours of sleep. When you sleep is very important. The sleep time from, like I say, 10:30 and until 4 o'clock is the peak time where your body recovers, repairs, and reduces inflammation and stuff. So if you could get that sleep, the sleep that you have after 12 or 1 o'clock, you miss that a good amount of sleep that repairs your body. So quality of sleep is very important. So try to organize yourself in a way that you follow the circadian rhythm and you sleep by 10:30, and then if you can wake up at 5 and 6 o'clock, it's fantastic. You walk into the vibrant, stable state of vata, and that gives the clarity and motivation to start your day right. So that's the one thing. And paying attention to your menstrual cycle, and whatever that you feel during the menstrual cycle is an indication of so many things are out of balance. If you're feeling strong pain, aches, or emotions and all those things, so it just body tells you what's been suppressed and it's coming to the surface. So give yourself a chance to work on those things. Go to an Ayurvedic retreat, maybe do a panchakarma. And doing a regular cleanse, panchakarma is created to remove ama from the body. If you ever get a chance to do a panchakarma, you're listening and you want to keep your body free from ama, you should definitely consider doing panchakarma.
Yeah. As I always say, it's great to take that time out at some stage in your life to really get away from it all and to invest in a panchakarma so that you go into that healing cocoon and everything is taken care of and you can just completely relax. If you have the opportunity to do that, it's a wonderful thing to do. Wonderful. Thank you very much, Dr. Sujatha. And can you tell us more about AmrtaSiddhi, your panchakarma you offered there, the new school that we've talked about in the past that now is operational?
Yes, we just started the new school.
Congratulations.
It's called the Ayurveda Hub. And it will contain Ayurvedic Academy, Ayurvedic Spa, and a health food Ayurvedic concept-based restaurant. My intention there is to bring awareness about Ayurveda. We have an Ayurvedic clinical aspect where we offer the Panchakarma, which is the original AmrtaSiddhi, where we work more clinically, helping people to heal, repair, detox. But this is more of bringing awareness. If anybody is interested in studying Ayurveda or want to know what is Ayurveda, what they can receive through Ayurveda, this is like a little, playground. And then you can deepen your knowledge by joining the Ayurvedic Academy part of the studies. And we are in Bali in a village called New Kuning in Ubud. Here people can come for studies or for healing, doing panchakarma, understanding and knowing self-care method, lifestyle routine, and to take health in your hand and empower yourself and know how to nurture yourself, how to feed yourself, what nutrition works and what is nutrition, all those things that we provide to people who come to our center.
Beautiful. Well, congratulations again on the new school. Absolutely fantastic. So Dr. Sujatha, as always, thank you so much. I truly appreciate your time and thank you for this very informative episode on breast cancer. Much appreciated.
Thank you, Colette. And it's nice that you're offering these sessions, and whoever they're seeking for this knowledge, I hope this is helpful.
I hope you enjoyed that conversation with Dr. Sujatha, and please check out the show notes for all the links mentioned. And if you would like to undergo your own cleanse experience, I provide online cleanses, which you can do at home. This cleanse is tailored to you. It comes with a 90-minute online consultation with me so that I can tailor the recipes, the lifestyle, the self-care and mindfulness practices to you and your lifestyle. And I will support you through the process also. You can do a private cleanse at any point throughout the year and choose your own dates. And the next discounted group cleanse will be at the end of the summer season, October 3rd, to get rid of that excess heat out of the body before we go into the autumn season. If you want to learn more, click on the link in the show notes or visit my website, elementshealingandwellbeing.com. And if you think this episode will be helpful to family or friends, please share it with them so we can spread this wisdom of Ayurveda. If you haven't already subscribed or followed the podcast, please do so. And the new weekly episodes will automatically download for you. And please come join me on social media. You can follow me on Instagram under Elements of Ayurveda Podcast and on Facebook under Elements Healing and Wellbeing. Thank you so much for tuning in. And until next time, take good care of yourself, be well, and bye for now. Slán go fóill.